Friends, it's Dr. Cameron Roxar, and today I'm going to talk about non-surgical skin tightening procedures. A very common questions patients ask me is, what is the best non-surgical skin tightening procedure? And I think when we answer that question, we have to really answer it as, are we looking at your procedure to be completely non-invasive or slightly minimally invasive? Obviously, I think in our field, we feel that the gold standard is a surgical face and neck lift, but a first surgical face and neck lift is for the older population. It's got downtime, you have scars. Sometimes people don't like the appearance because it doesn't look natural. Some people get the wind tunnel appearance, they're too pulled back. So the non-surgical skin tightening procedures that we offer are extremely popular for all those reasons: minimal downtime, minimal risk, and so on and so forth. Every device that we use that causes non-surgical skin tightening uses the concept of heat, because heat contracts skin, and it does it in two ways. First, intense heat causes immediate contraction of the skin, and second, heat causes collagen remodeling. Collagen, which is a natural protein that we have in our skin, is like a spring. It's a helical molecule. So heat can actually, you can think of heat that can actually tighten that spring. The other advantage of non-surgical skin tightening procedure is that your tightening is three-dimensional versus a surgical facelift is two-dimensional. It's a vector lift. So a non-surgical really lifts, a non-surgical facelift, really you're tightening in an XYZ axis, three-dimensional. So how can you deliver heat? Well, we have different mechanisms. A very common mechanism is radio frequency. Radio frequency is really electric current. As it goes in and encounters resistance, it heats up your skin. The first radio frequency skin tightening procedure came to the market was Thermite. It's been around for 20 years, kind of old technology. I've retired my Thermite machine because we have better things now. Another form of skin tightening procedure is Ulthera. It uses ultrasound. Ultrasound we're all familiar with. Diagnostically, we use it to look at babies, in the womb. But here it's focused ultrasound. So this focused ultrasound in the skin gets converted to heat, and that heat causes skin tightening. So Ulthera, oil therapy, soft wave, those are things that use radio frequency. Now there are devices that use microneedling and radio frequency, so they actually deliver the heat through needles inside your skin, and those needles heat up your skin through radio frequency. An example of that is Morpheus. That's not completely minimally invasive because the needles are piercing your skin. Lastly, my favorite, and this is in my opinion the gold standard, is Thermite. Thermite is minimally invasive because we actually heat up your skin from inside out. And a similar cousin to Thermite is FaceTite, which you may have heard of. So the way Thermite works, it's the most accurate way to heat up the skin. We're inside, we numb your skin from inside out with fluid, and then we use a probe. We insert this probe, which is just like a needle, a long needle, inside your skin, and we heat up your skin in a systematic manner to safe temperatures, to the highest temperatures we can heat your skin up to, but in a safe way, because we have a very advanced infrared camera that scans the temperatures from the outside, that we don't go above a safe threshold. Incidentally, this advanced infrared camera that we use was the camera that was used to find the Boston Marathon bomber who was hiding in a shed. So it actually is a heat-seeking camera. It's very precise. So again, it's the answer to that question, what is the best non-surgical skin tightening procedure, is complex. The answer is not simple. If you're willing to have a little bit of downtime, a little bit of swelling, Thermite is the way to go. The results for Thermite last 3 to 5 years, a long time, and it gives you a lift similar to a mini facelift in a very natural way without scars and surgical incisions. If you have zero tolerance for downtime, if you're younger, in your 30s and 40s, you want a procedure that has no downtime but works, my go-to is the Ulthera. The Ulthera in the right patient is reproducible. It gives you great results, almost no downtime. I hope you found this presentation helpful. Dr. Cameron Rockstar signing off.